The changes that are happening in the U.S. healthcare environment in some areas are delivery of care, patient participation, and healthcare coverage. The priorities in America are so off, and it reflects on what they are more fascinated by. New Zealand's healthcare system has undergone remarkable transformation throughout the past years. Government reforms have introduced health and market insurance aspects in the last 2 decades, resulting in a mixed private-public healthcare. Unlike most healthcare systems in other developed economies, in New Zealand offers access to all essential types of health services such as community pharmacy, child health, surgical and medical specialist services, disability services, emergency services, transplant, health of old people, and mental health. Canadian healthcare is a mix of public-private system where the private sector provides healthcare services and the public segment is responsible for funding those services. Moreover, while governments fund the large majority of services, the private sector does play an important, although secondary role in healthcare financing, which has helped the country develop an efficient healthcare system. More so, the Canadian healthcare system has the secondary care services comprised of broad range of specialized medical services not normally offered by family doctors and community health clinics. The Canadian healthcare system, however, is not entirely consistent with the model. Canadian government exercised substantial authority over the delivery of services by the private segment, Duncan 2016, versus private specialists and other complementary health providers. In New Zealand, work minus government support regarding funding unless they offer a service to an injured patient covered under the Accident Compensation Corporation Act and are not obligated to service a particular population. Canada would be first in the ranking, the second would be New Zealand, lastly the third would be Australia. A lot of Americans would love to have universal healthcare like Canada because it seems to have been working well for them. New Zealand is lots of great free medical services, but it's funded through massive taxation. Now, in Australia, private insurance is received by half of the Australians as an additional coverage, which is subsidized or sponsored by the government, and it covers services like dental care in private hospitals. The negative is possibilities about how best to stabilize and balance public and private sector in funding and delivering health services. On the free-for-service platform, avenues for overpaying for our service existed, whereby a patient overpaid for services or prescriptions simply because the service providers wanted to make more money. The value-based purchasing VBP through the Center of Medicare and Medicaid Services (CMC) ensures that an exaggerated payment are made for quality services. CMC rewards hospitals by quality of care they provide, how patients experience during stay, and their adherence to clinical practices. The United States Health Care Department should enact policies that make it compulsory for state governments to provide universal health care insurance plans for citizens.